Hello, my name's Dr. Valerie Donaldson. I'm here today to talk to you about vaginal rejuvenation and stress incontinence using Viviv Solutions. So Viviv Solutions is a medical technology company whose mission is to enhance women's lives by providing clinically proven, non-invasive, safe, and high-quality products that improve a woman's quality of life and intimate health. The machine that I'm going to be talking to you about tonight is called the Viviv, and this is what it looks like. And I am going to hop out of the screen right about now, and I will entertain questions at the end of the webinar. So this is the machine called the Viviv. As you can see, there is a little handheld device here that is a probe that goes into the vagina and will increase collagen formation around the vaginal wall. How I got into this is really because of my hobbies. All the hobbies I do, I'm putting a lot of stress in my pelvic floor, including riding horses and running marathons. I'm always jumping up and down. Even with 5 kids, I've been jumping up and down. So through the years, I noticed that I started to leak urine when I was riding the horses or running, and it became very uncomfortable for me. So I started looking for some kind of therapy that would be non-invasive and easy to do that worked. When I started looking, I then came upon this solution, the Viviv Solutions. And Viviv is not the first machine I looked at. I have been treated by 2 other kinds of apparatuses that are similar to the Viviv, but not like the Viviv. And I settled in on the Viviv for multiple reasons, and those reasons I'll give to you as we go through the webinar. So the first thing I'm going to talk to you about tonight is stress incontinence, because this is what really brought me to seek the Viviv and seek treatments. And stress incontinence, I found out, really was very, very common in women, which I didn't know, because women usually don't talk about stress incontinence to each other, which is interesting, as women talk to each other about a lot of things. But stress incontinence was really one thing that had never come up much in conversations with my friends. And I found in talking to my friends about it that they also didn't talk much about it. If anybody thought they had some stress incontinence, they just thought it was, typical of their age, or it was just because they had, had children, and this is the outcome, and that's the way you're going to be the rest of your life. So about 1/3 of women experience urinary incontinence over the age of 16, which I think was quite a number of women. 1/4 of your college athletes, again, because they're jumping up and down and their pelvic floors are being stressed all the time, will have urinary incontinence at a very young age. And then the question is, are you experiencing stress incontinence? When it first started happening to me, I kind of put it on the back burner and just ignored it and thought, okay, well, this is just, one time happening and it's not going to happen again. So if you have any stress incontinence, it happens when you laugh really hard, you cough, you sneeze, or you work out. A lot of people or women start using panty liners just to protect for leakage. And again, it becomes an everyday thing, and you don't think that anything's really, quote unquote, wrong with it, or that there's anything wrong with you. Another sign is that tampons start slipping or not feeling as snug as they used to, because the lining of the muscles are getting weaker and weaker. So how stress incontinence affects your lives is very poignant. It really starts to restrict the activities you do. I know it did in me. I know I would go out for my run, and if I started having some incontinence, I'd just run back home, and then it would be too much of an effort for me to go back out running again. It's really started limiting my choices and things I did in my life. I remember one time when the kids were home and they all wanted me to jump on the trampoline with them. And all of a sudden, after I jumped on the trampoline, I thought I can't do this anymore because of stress incontinence. And so I didn't get to jump on the trampoline with my kids. So ultimately, in some women, these restrictive feelings can lead to depression also because they're being held back from doing the things they may want to do. Also, women start wearing more and more panty liners, being embarrassed that they may leak or smell, around other people. And the other thing is, if you're having very bad stress incontinence, you don't want to have sex with your partner. And because of all of the above, you tend to not go out as much as you ordinarily would go out. So it's really something that affects our lives in a bigger way than just having the problem of leaking urine when you cough or when you laugh. The traditional treatments for stress incontinence are really not very pleasant. There's a pelvic floor physical therapy that you have to work hard at, and certainly it's okay to have to work at exercise and strengthening your pelvic floor. Kegels is the therapy that they use mostly. They also use vaginal pessary inserts, which are little round things that look like dishes that stop the flow of the urine from coming out and put pressure on the urethra in order to do so. There are invasive procedures, including the bladder sling that is done by surgery. And none of these are pleasant to have to do as a treatment. So there were 6 things that actually convinced me that Viviv was going to be the treatment for me, and Viviv was going to be the machine that I would get. And the reason I say that is because, number one, there were clinical studies supporting its use. 2, they had already put in for a FDA approval for stress urinary incontinence. They had that much data collected and clinical trials done. I met with the CEO, and that CEO is very committed to a woman's quality of life and was very empathetic and sympathetic to what a woman would go through with stress incontinence and if she needed any vaginal rejuvenation. I was very impressed with him and his intent and the mission of the company. The treatment is a single 40-minute treatment. This is different than most applications that are similar to the Viviv. Most of the applications that are similar to the Viviv have you come back 3 times a month apart, and that becomes long and drawn out. So the idea of having only one treatment and being done with it was very interesting for me and fit into my schedule. The Viviv is different than other therapies because it combines 2 different treatments together. One is cryotherapy and the other is radiofrequency, both of which have been shown in trials to increase collagen formation in the skin. So in number 6 was really, I tried it and it worked for me, and I got really excited and then had to have the machine. And I tell people everything I have in my office is for me. So I get very excited about it, and then I would love to share it with other people. But for me, if nobody else had even used the Viviv in my office, I was excited to have it just for me. The nice thing about Viviv is it started out to be for stress incontinence, and the FDA approval started out to be for stress incontinence. But really what's happened is that the side effects of the treatment for stress incontinence was your vaginal rejuvenation. So the best thing about the Viviv, as I was learning about it, are really the side effects. And all of these things listed here do happen to all the women that have the Viviv treatment. And it was very much a surprise for me that all of these things would happen after one treatment. So the first thing that people really talk about is that all of a sudden they have increased vaginal lubrication. And it doesn't matter if you are on hormones or off hormones or don't need hormones. The vaginal lubrication happens in everyone. Also, the other thing that happens is that your libido is increased and your orgasms are increased. You'll notice that you have increased strength in your vaginal wall area. As when you do Kegels, you can feel that it's much stronger and easier to contract. Decreased urinary tract infections are going to also be an outcome of this treatment. So when I see and talk to women that are telling me they have urinary tract infections all the time, all of a sudden as they start aging, then I know that their vaginal wall is not strong any longer and they really need a VAVIV treatment. And interestingly enough, you know, when you're thinking about treatments and thinking about hormone therapies, the VAVIV is the place I would go to first for a woman that has urinary tract infections all the time. If you just do hormone therapy alone, it's not going to take care of the urinary tract infections. The VAVIV works on everybody, and this was another drawing point for me, is that if you're not on hormone replacement therapy as you age, if you are younger and you've had a cancer and your hormones are down and you can't take hormones, you can use the VAVIV. And to me, this is a godsend for all of those women that have problems with intimacy because they've had their hormones taken away from them at a very young age. The other place that it's really helpful is after somebody has a baby and the hormones aren't quite balanced yet. If you have the VAVIV done, you increase the strength in your vaginal wall and you start balancing your hormones faster than if you did not have the VAVIV treatment. So it's really a wonderful thing after having babies. As your desire and libido increases, so does the intimacy with your partner. And this is one side effect that I think is priceless and that people of every age not only need but desire. And once you get that intimacy back, magic starts happening for everybody. And even better yet, so this was something that I put together. The VAVIV takes can take up to 4 months to really get its full effects. And so I thought, well, if we can combine the VAVIV with what they call the PRP shot and make it really a wow pop from the very beginning, it would be awesome. So we've been doing this, and we do the PRP shot at the same time as we do the VAVIV. What happens here is it augments the effects of the VAVIV, and the VAVIV works faster and longer, we've seen, and stronger, I guess I would say. So we call it the wow shot now, and it is wonderful. With vaginal rejuvenation, your sex life increases, your orgasms increase, you're more alive, you have more vitality, and you have a whole lot more intimacy with your partner. And all of these things really enhance your life more than anything else really does in life. How the VAVIV works in the vaginal rejuvenation is interesting. So up in the left-hand corner, you see a picture of before the treatment. And then during the treatment, there are waves that go into the vaginal wall and start treating the vaginal wall. With radio frequency, you have heat, and with cryo, you have cold. Both of those modalities are affecting the lining of the vagina to increase collagen formation. After the treatment, you see much healthier tissue. It's more formed. It is tighter and tauter and more full. The picture on the right bottom, you should expect to see within about 3 to 4 months. And again, with the PRP shot or the WOW combination, you'll see this happening at an earlier time. So what you should expect during your treatment day, we don't use any medications. If you're having the PRP shot, we do anesthetize the area where you're having the shot so you don't feel that. Otherwise, there's no anesthesia at all. There's just a small probe-like device that's placed in the vaginal area for several seconds, and then it will move around the vagina to treat the entire vaginal wall. The heat that comes from the radio frequency causes vaginal collagen restoration and production, and then it is cooled immediately by the cryo, which also increases collagen formation. The patients say that they feel sensations of cooling or of warmth or both. It's really a very pleasant treatment. And I have to say, we have an incredibly pleasant and wonderful nurse that does this treatment. Everybody falls in love with her. As I said, most patients find the treatment extremely comfortable. Scar tissue is the only tissue that really can be somewhat sensitive in doing the treatment. And if that's the case, then we put a little bit of lidocaine cream in to decrease the pain sensation, and people are just fine. One session takes about 40 minutes, and usually you only need one treatment every 1 to 2 years, which is pretty incredible. And I've seen that happen in women of all ages. I guess I haven't done anybody over 70 yet. So are you a good candidate for Viva? Is it something that, really that you should do? And so I would say, yeah, if you have any urinary incontinence, absolutely, it's a #1 priority. If you have any air passing from your vagina during exercise, yeah, your muscles are sagging, you need the Viva. Vaginal dryness, absolutely. You'll be absolutely amazed when in 24, 48 hours, you suddenly have vaginal lubrication again. Vaginal laxity, absolutely, you need the Viva. If you even have poor orgasms or decreased libido, and again, whether you're on hormones, off hormones, this is a great treatment to have. It works really immediately. So after your first treatment, you're going to have an increased libido. It's absolutely wonderful 6 months after delivery or 6 months post-nursing to get everybody back in shape. There are some warnings that you need to know about that if you are currently pregnant or planning to become pregnant within the next 6 months, we do not advise you to do the treatment. If you're currently breastfeeding or have been breastfeeding within the past 6 months, we ask you to wait. We ask you to wait if you're undergoing current chemotherapy or radiation therapy because of a higher incidence of infection when you're having these therapies. If you have any open lesions, we don't like you to have the therapy. If you have any large metal implant, you should not have the therapy. If you're taking any anticoagulant, if you're able to come off of it, then you can do the therapy. If you have to stay on it, then we'd have to get a permission from your doctor. If you have any kind of a chronic medical condition of the vaginal or vulvar area, you should not do the Viva. Or if you are a highly allergic person, you should not do the Viva. But what to expect in office really is a really comfortable one time. I put 45 minutes. It should be 40 minutes in the office treatment. And during the Viva treatment, the tissue is cooled and heated at the same time. Your body responds to the treatment by generating new and restoring existing collagen. And here I say, women feel results in about 30 days, full effect at about 90 days, because that's what I'm told to put down. But really, all women will tell us they've had a good experience within a week. Sustained results have been documented at 12 months. I have people that have gone 2 years now. So what patients are saying is really quite wonderful. I think it's very rewarding to hear somebody talk about their experiences with the Viveve. So a 63-year-old with 2 children said, I thought I had my stress incontinence under control and Viveve would not make that much difference, but boy, was I wrong. It's the best thing I've done. The outcome was way beyond my expectations. 56-year-old with 1 child said, my husband used to chase me around the house for sex. Now I'm chasing him and I love it. Thank you, Viveve. Another 42-year-old with 1 child. Thank you for saving my marriage. And then a 28-year-old with 2 children said the WOW treatment was painless. And by the next day, I felt myself tighter inside. Now I feel confident and back to my old self. So as you can see, women of all ages are grateful and thankful for the quality of the treatment of the Viveve. The Viveve solutions are really 2 different things. One is the in-clinic Viveve treatment that I've been talking about. There's also an at-home device that you can use to augment the treatments of the Viveve that we do in the clinic. This is totally optional, and it's something that you do several times a week for about 6 to 12 minutes at a time. And it's just you put this probe inside the vagina and then just start squeezing down on it. There is one device that has a calibration on it where you can actually measure the strength of your muscles when you squeeze. This is another picture of the Attain, which provides this biofeedback program where you can actually see how much strength you have in your vaginal wall. So why is Viveve over the top amazing? Well, it really is over the top amazing. It's been amazing for me. I will never be without it personally. The system is designed to treat women who are experiencing urinary stress incontinence, which again is leaking urine when you're laughing, coughing, sneezing, or jumping, or doing something like that. And it's also for women with any kind of sexual dysfunction, low libido, just no interest in vaginal laxity. And it does this, all of this in one session, which is to me just totally amazing. So the benefits are priceless. A woman gains her freedom, her confidence. She gains more intimacy with her partner. She becomes more alive and more vital. And to me, those are things that money really can't buy. So thank you for your attention. And if you have any questions, please start typing them in the chat box. I'm happy to answer any questions. Also, Karen will call you to see if you have any questions or if you would like to sign up for an appointment or need to talk about it at further time. So have a good evening and thank you all very much for coming.